dealing with arthritis, or maybe joint pain. We have some expert advice today on surgery and treatment. Dr. Caruthers is with OSS Health, and he is here with us this morning. Thanks for joining us.
Thanks for having me.
Let's start with a little bit of an explanation. What is osteoarthritis?
Yeah, sure. So I'm a surgeon who specializes in dealing with hip and knee arthritis. So arthritis is something that happens to a lot of people as we age. What arthritis means is the breakdown of the normal cartilage that covers joints. So joints are covered by something called articular cartilage. Over time, that articular cartilage can start to break down and wear out. I describe it to patients, it's like the tread on the tires in your car. As the tread starts to wear down, you start to lose mobility and function. Same thing happens in a knee. As you lose articular cartilage, you can develop pain, swelling, inflammation. And cartilage is not something that tends to come back over time.
It's something that's pretty common. So tell me about the treatment.
Yeah, so definitely. This is something that I treat quite a bit. Obviously, the first thing we start to do is treat with the most conservative measures that we can. Over-the-counter medications are the first thing we tend to start with. Advil, Aleve, ibuprofen, Tylenol, therapy, bracing, injections are other things that we can do. There's a couple different types of injections that we try. Ultimately, you treat arthritis with a joint replacement surgery.
Okay, so when we're talking about that, what all is involved?
Yeah, absolutely. So I brought some examples of what a joint replacement looks like. So a joint replacement is a resurfacing type of a procedure, right? So you're replacing damaged bone and cartilage with metal and plastic. And this is what a joint replacement will look like in the knee. And this is a joint replacement with a couple different parts to it. There's a femur on the top, a tibia on the bottom, and then a plastic liner in between that creates the new bearing surface.
Okay, and so when we're talking about that, what kind of goes into the treatment afterwards? How long is somebody out after they receive that?
Yeah, so after a knee replacement, you're typically out of commission for about 6 to 8 weeks. That's about the same for a hip as well. Knees are a little bit tougher. They require some therapy, some rehab. 6 to 8 weeks is about what a recovery time is for a joint replacement.
Okay. There's a specific type of replacement that we're going to talk about, a Mako robotic joint replacement.
Yeah.
What is that?
Yeah, so robotics is kind of a new thing to joint replacements, and I think it actually helps quite a bit to make things go a little bit smoother. So what robotics actually allows us to do is to plan the surgery and do a better job planning it ahead of time. Okay, so what we actually do, what we had to do traditionally with the knee replacement, in order to put these implants into place, what you'd have to do is make a series of cuts. So it's actually 1, 2, 3, 4, 5 along the top bone, the femur, 1 across the tibia on the bottom to create this new implant. Okay? And so what we used to have to do to line these up was actually drill holes inside the femur, drill holes inside the tibia, and then place cutting jigs on and try to line up the best position for those implants.
Wow.
What the robot actually does is allow us to plan this ahead of time, allows better sizing, it allows me to balance the soft tissue tension intraoperatively and make adjustments to that to give a better functioning knee and a more balanced knee and hopefully help with recovery.
Sounds like there are a lot of benefits to that type of surgery.
Definitely.
All right. Well, how can someone schedule an appointment if they have arthritis or want to talk to you about something?
Yeah, absolutely. So I work for OSS Health. We have a bunch of different offices throughout York and also Dauphin County. So I work up at a Mechanicsburg office, and I also work in York at the Powder Mill office. So we have osshealth.com. We also put up the number 848-4800. You can always call for an appointment.
Wonderful. Thanks so much for great information today.
Perfect. Thank you.